do a blog about my scoliosis story. Chris felt that I should, and I got a lot of positive feedback and people saying that if it helps one person it would be worth it, and I absolutely agree with that. So it all started when I was in 7th grade. They check every girl, at least I know, for scoliosis by having them do a test where they bend over and they just check your spine, because that's where it really presents itself. You can see where the curvature is. So that was the first indication that something wasn't right. They wanted me to go see a doctor, and it was determined that I have scoliosis. So that turned into me having to wear a back brace. As you can imagine, that during those formative years was not the greatest situation. I'm already rather introverted, and then knowing that I'm wearing a back brace that I was trying to conceal, it just wasn't a recipe for, I don't know, being the most comfortable in my skin, I guess. So I wore this back brace all the time besides when I was sleeping for at least a year. I went through, I think we had 2 different back braces made, so in this year. So they would try to make the back braces press against where the curvatures are, so that basically it would straighten out my spine, or prevent it from, it was to straighten it out. So if my spine's going like that, the back brace would press against that curve, and it was so painful to wear that thing. But obviously I wanted my back to be fixed, my spine to be straight, so I dealt with it. And then as it continued to worsen, they made one that I would have to go to sleep in, so I'd be wearing it all the time, except for when I was riding my horse. That was the only time I had a break from those braces, and that was like truly my therapy in every way, was being able to ride my pony. And so went through a second year of wearing this back brace, 4 braces at this point, and it was still getting worse. They always said if it developed to become a curvature of more than 50 degrees that I would require back surgery. So what it is a spinal fusion, and it's 2 rods from the thoracic, I want to say it's like T3, I don't know exactly what it is, all the way down into my lumbar spine. I don't know which vertebrae, it was too long ago to know. But so it's 2 long rods and a whole ton of screws. I'll show you the x-ray. I'll show you both x-rays, where it's the pre-surgery and then after my spine was fused. And that is 13 years ago that x-ray was taken. I don't even know what my spine looks like now. I would like to find out, but that's for another day. So they did the surgery because I had reached that severity where the back braces were totally in vain. They did nothing for me. I kind of wish we had just done the surgery 2 years sooner when we discovered it, but you know, you have to exhaust the less invasive efforts first. So we're gonna go this way. So we're just out on a little cruise. I don't know where we're going. I'm just following Salt, Chris, whatever you want to call him. So I had the back surgery. I was in 2005, and I was in ICU for the first night, in the hospital for 5 days. After a couple days, they had me get up and walk for the first time. It was so painful. It was a struggle. But anyway, so my body started to heal over time. I remember, I think it was like 3 weeks out from surgery, or after surgery, I was like doing sit-ups because I thought I was going to get in shape. I don't know. The good thing is, obviously my spine was starting to heal and I was able to bend it. So I had surgery on November 16th, and I remember saying that the only thing I wanted for Christmas was to be able to ride my pony. Now, they told me, and this was the biggest thing about having the surgery that I had an issue with. It wasn't them cutting me open and moving and manipulating my spine all around. It was the fact that I wasn't going to be able to ride my pony for 9 months. Yes, my brights are on. Thank you. So 9 months at that point, when I was riding my pony every day, it's all I looked forward to. I mean, it is my life passion to ride that pony. This is another one, but riding my horse is the biggest, to be completely honest with you. Yes, I will choose my horse over this amazing bike 10 out of 10 times. So I wanted to ride my pony for Christmas. I convinced my mom to go out on a trail ride, which is just like a simple ride, and that I would only walk. Little did she know, when she got far enough ahead, I was trotting too. So I was definitely, I kind of started to ride slowly. And not that I would condone this, I knew that like the issue was if I had fallen off, if my spine hadn't healed yet, it wasn't fused, so it could break and I'd have to have surgery again, and that was like the really big risk. And I knew my pony, and I knew that that wasn't going to be a problem, so that's why I started getting on her. And within a few months I decided it was time to sell the pony and get a big horse, because I wanted to jumps as tall as me. So I sold her. We went out and tried a very large 17.3. I think it was more like 17.1. It was a long time ago. I went out and tried this thoroughbred who ended up falling on his face when he spooked at a miniature horse that was coming by us. I don't know why. He had this massive fear of little horses. So he falls. I ate dirt. There's literally dirt in my eyes and my ears everywhere because I just went down. And that was before I was even cleared to ride. I think it was 6 months out of surgery. And so thankfully everything was fine. I didn't have an issue whatsoever. And I, oddly enough, decided I was going to buy this horse because besides the fact that he fell over, I really liked him and saw potential in him. I had him for a few years and fell off him a few times when he would spook and fall himself. He continued to fall. I don't know what it was with him. He maybe just had balance issues, but I learned to stick, so there was a lot of positive in that. But anyway, so here we are now. Life after surgery. It did not fix my spine. It helped the curvature a little bit. I think it was something like 10 degrees. It took off, so it was like around 40 degrees was my upper curve. I have the upper thoracic curve to the right, and then the lower lumbar curves a little bit, or lesser anyway, to the left. So instead of my spine being like this, it's like that. So you can imagine that affects my entire body. And as a horse rider, a dressage rider at that, where it's all about being balanced and doing very difficult movements for both the horse and the rider, that is a challenge in itself. So I have spent all my time since basically learning how to manage that pain. It is going to be a lifelong thing. The pain is always going to be there, but at least it's lesser than it would have been. My lung capacity was really being impacted by my spine when it was at its worst, so it's better now. And I spend 5 out of 7 days a week in the gym working on supporting those muscles, or growing the supportive muscles, and just trying to improve my mobility however I can so that I can be as functional and normal as possible. And basically what I'm getting at, there's a Popo and he's holding a drone. That was interesting. So what I'm getting at is that these kind of challenges in life, while they may, for a lot of people I know, it can be really debilitating and discouraging, and some days I am very discouraged, and in it, the pain presents itself in a lot of different ways. It can be my upper back, my lower back, my shoulder. It's really, especially where my shoulder blade, my scapula, and my spine, basically there's this one spot where they compete for space, and then there's a nerve inside that gets pinched. That's like the worst pain. So that can be super discouraging for people, and a lot of them just decide to do nothing and complain and medicate, and I don't like medicate with narcotics and things like that, and that's just a path it's not worth going down. I mean, really staying active is the best thing you can do in this kind of situation. I think in most situations where you're still physically capable, what is he doing? You want to be able to move around and keep that blood flowing and keep that circulation, because that's where issues really start to happen, is when your blood's not moving around. So I'm just gonna leave you with this. Don't take anything as a sentence. Do not give up. I mean, I have so many excuses on days when it hurts that I could say I'm not gonna go to the gym or just give up, and it's not worth it, because there's always good days and bad days. Trying to make sure I don't get hit here. You're gonna have good days and bad days. I mean, we all do. Whether we've got health issues or a perfect body, which who really has that anyway? We've all got issues. So just keep pushing. Do not give up. It's amazing. I mean, even in a year, how much things can improve if you just take it one day at a time and be gentle with yourself. I have my insecurities with it. I try to conceal my back as best as I can, and so many people tell me that nobody would ever know if I didn't say it, and that's great, but I see it. So you never know what inner struggles people are dealing with. Don't give up. I think I'm gonna have to end it here because I don't know where else to go, and I think this took way too long. But at least I'm still recording. Alright, peace out.